So I think in Hodgkin lymphoma, immune checkpoint inhibitors, particularly PD-1 blocking antibodies, have really been exceptional, and they are helping patients, particularly who have failed standard treatments, chemotherapy and transplant, for example, and really again been approved in that space. So I think, as a patient, that's a therapy that you should be thinking about or talking to your doctor about, because it's going to be most likely quite beneficial for you if you've relapsed, particularly post-transplant. I think the challenge is now to say, how can we use these therapies to avoid even getting to the post-transplant setting, because patients hopefully would do so much better earlier on. So right here at the ICML meeting, there is utilizing nivolumab, one of the PD-1 blocking antibodies, plus standard frontline chemotherapy, the AVD regimen, which is like a BVD, but just leaving out the bleomycin. And it shows that that's an effective regimen, the benefit is durable, and so now next things that are happening is to take that combination and test it against a standard combination to see if it really is as good or hopefully better. That's kind of upcoming.